I think so it's wild. So, yeah.
Like, yeah, to press.
Well, maybe need to.
Yeah, so.
The two of the mayor, I don't wanna be like that, so. It's really that budget, and I also give it.
No, where, but. Regularly, and one might be ready to go.
See, and I should have thought of this, because I should have gotten a lot of your.
We only have 2 mic channels.
Someone would, whoever sits next to me, and it's.
6 o'clock, I guess.
Yes, it is. I'm just waiting for Daniel to.
It's like, oh, I should remember this.
And.
So Liz will put you at the your.
Next, yeah.
They're good. We got one. Do you need anything?
My water. Hey.
It is a good crowd.
Yes.
Like, by the way. I said anywhere? Good. No, I just.
Not sit there.
Thank you.
I would, I want to sit here. Then we'll have Dave. So and you and Dave are gonna share a mic. You'll have to pass it back and forth. And then Liz and Alex will be sitting them up. But we've got water bottle for you. Do you need anything else?
That's good. If I pass out, just give me a little.
You pass out, well, yeah, we'll slap you if you don't respond.
I'm good.
We'll drag you off. No, don't worry, that's not our first rodeo.
Actually connect you, and then I can all drag you.
I feel like you might know some service providers that.
Yeah, we'll be fine. We'll be fine.
Good. I'm gonna introduce Tom. Be here for his remarks, and I'm gonna.
Are you still pretty involved inside?
Anyway, never.
Yeah.
And that's my full good. It's like, I've been there.
Okay. Okay.
You don't need anything.
Okay, that's what I thought.
It's the high sign.
Okay.
Okay, Catherine's gonna let people in. And got one of these seats here.
Absolutely. Yeah. Next some time, but yeah, the chat was.
That turn.
What we got?
Kind of a long educational journey. Yeah, let's do this one.
Table
Started up and I'm sitting a lot of fun there.
There's a reason I didn't go to the others.
And
I was there for a visit, and I was like, I don't think I even learned.
yeah, if I was smart, that's not a good idea. Anyway, but I was there for a few years, ended up graduating from BV. So,
Let me finish the Catherine is at the building.
got my master's from Missouri State University in business, MBA.
No, they're coming late.
I don't know that school, but I know BV is a good school.
Yeah, it's wonderful. Small. I needed small. I wish I would have done.
I went
A little bit.
It's like.
Frowning.
Can't do it. And then I visited on the side, and I was gonna be able to play.
I actually have papers. I'm using the podium because I need something.
I wish I would have known that when I was young.
She was last night trying to trouble.
Hard lesson.
Order anything or no?
No.
See, and thank God that was like a guiding star at least. Like I knew if I was gonna go to Iowa, I wasn't gonna.
Just think, honestly, like it seemed like what everybody was doing, and
I always.
I felt pressured, like every certain was
So.
doing that, and I didn't like the intro. Yeah, and I'm like,
So.
it wasn't the best place to be.
At least you realized
Yeah, figured it out.
some people don't.
You had more experience at this than I had.
Look at you right now. Her title, we're presenting it from
My theater background.
Okay.
We shared the night.
Be real nerdy, so here we are.
I think we're waiting.
That's gonna be. I do know the behind the scenes story, so I'd like to assume that.
Like, man, I really feel that for the work.
I feel better just doing it.
Anymore.
I was gonna say, I talk constantly.
Yes, yes.
I feel so.
Same.
And then I will just be like, all right,
I'm really hoping that this is gonna answer that.
exactly. Actually, don't know that answer, but I think we are gonna get. Where it is, we're gonna get.
Steve says, who's introducing
Fred introduces you, you talk, you introduce Dave, and we're done. Dave will.
Yeah. This will be your staff.
Good evening. And welcome to From DC to Iowa, how disability policy shifts will affect the disability community. I'm Craig Owens. I'm the Executive Director of the Harkin Institute for Public Policy and Citizen Engagement. And we are so proud that the Iowa Disability Policy Alliance has chosen to hold its inaugural event at the Tom and Ruth Harkin Center. The IDPA's mission is to bring people and organizations together to empower the disability community, raise voices, take action, and shape positive policy change. The Harkin Institute is honored to be part of that alliance. At this time, I'd like to ask those here representing the many IDPA member organizations to raise their hands or make themselves otherwise known so that we can acknowledge your contribution to tonight's event. Thank you all. Thank you all for making. The Alliance works to strengthen disability advocacy in Iowa through a common voice, collective action, policy development, and leadership so that Iowans with disabilities can live with independence, dignity, and the opportunity to thrive. So thank you to all of our fellow members of the Alliance. Also, thanks to members of the Harkin Institute staff who've made tonight's event possible. Daniel Van Zandt, our Director of Disability Policy, Mindy Jones, Director of Operations, Ashley Ezio, the coordinator of our Uplift project, along with Michael Berger, who is the assistant coordinator of the project, Morgan Ryan, our student chief of staff, and Catherine Kuckelman, Director of Communications, whose last day at the Institute is tomorrow, I'm sorry to say. So a special thanks to Catherine for working late the night before her last day. Before I introduce our next speaker, just a couple of logistic items. Members of the IDPA will be hosting or continuing to host information tables after the panel discussion. Panelists won't be taking questions, but IDPA member organization representatives will be happy to take questions, help you out in any way they can after the program. There are 5 different restroom configurations in the Harkin Center, some of which are just down the hall and on your right. So if you need those, they're there. Wellness room upstairs. So if you'd like to take advantage of a wellness room or you need to, you can make your way upstairs. You can ask any of us with the silver name badges to help you navigate the building toward that. If you have a cell phone or other noise-making device that might suddenly and unexpectedly make noise and you're able to turn it off or silence that, we'd really appreciate it. And now, on to something more substantial. This inaugural event is one of several things that make this year particularly important in the life of the Harkin Institute. This year marks 50 years since Tom Harkin took his seat in Congress, and it marks 35 years since the passage of the legislation that is almost synonymous with his name, the Americans with Disabilities Act. That legislation typifies a natural inclination to support and advance policy that solves real problems for real people. The Harkin Institute strives not just to build on Senator Harkin's legislative legacy, but to continue that people-centered approach to policy and engagement. We're fortunate to have him here with us tonight to share some thoughts, and so it is my pleasure to give you the Honorable Tom Harkin.
Thank you very much.
Okay, Owens, thank you very much. And thank you all for being here for this event. And I thank all the exhibitors who brought all their tables and everything out there. I really appreciate that also. We have a number of different events concerning the broad disability community throughout the year here. So maybe some of you have been here for different events at different times during the year. Unfortunately, I'm not here for all of them, but I'm very happy to be here tonight for this. And Craig mentioned that this year marks the 50th year since I first got elected to Congress, right? First got elected to office. However, it's the 52nd anniversary of my wife Ruth being elected to office. You figure that out, you get it figured. She got elected before I did. Anyway, this is what we're trying to do here, I think, with this panel this evening is to try to think about how what happens in Washington really gets down to the pavement here. What happens to real people in Lamoni or in Keosauqua or in Red Oak or in Ames or around? What happens when decisions are made there and things happen? How does it affect people with disabilities in Iowa and their families, and their friends and their occupations and their jobs, and how they are able to navigate the sort of the ups and downs of what's happening in Washington, D.C. So I hope that's what we're going to be talking about tonight. I just wanted to point out a couple, three things. People with disabilities make about 29% of our population, okay, broadly speaking. So if we have segments of our society, professions, occupations, different kinds of jobs, education, that, let's say, only have maybe 2% of people with disabilities represented in those different sectors. You got to ask a question. Why is that? It's sort of like I remembered, mentioned names, but someone had said, well, if he got on an airplane and he saw a black pilot, he would hope that he was qualified. I thought, why would you say that? I mean, I would hope anybody flying an airplane would be qualified. But then the more I thought, you know, 92% of all airline pilots are white male. Well, why aren't there more black pilots or women pilots? Is that because African Americans can't fly airplanes? Did any of you watch the Tuskegee Airman program was on Veterans Day? Or women? It's ridiculous. It's just the way things were built in our society before we started having things like civil rights bills, an ADA bill, things like that, to try to break down the old systems that kept people that were qualified out of mainstream type of jobs and occupations. DEI, huh? Diversity, equity, and inclusion. I've never considered that a bad word. I've always considered that to be bedrock American value. So we started doing things to try to make sure the barriers were down. I've often said, you know, there's not a nickel or a dime in the Americans with Disabilities Act given to a person with a disability. All we did was broke down the barriers. Okay. Now go show us what you can do. Because we knew then, just as we know today. People with disabilities have a lot of talents, a lot of skill sets. But because of the way society has been structured, they're kept out. So we did things like we set up the Equal Employment Opportunity Commission. And guess what? In the last year, it's being decimated. And then, we fought for employment target goals. So we looked at the federal government and we said, wait a minute, we have less than 1% people with disabilities working in the federal government. But for 29% of the population, why? So we set up goals, not only for the federal government, but for federal contractors and subcontractors that are getting your tax dollars to operate to make sure they set up goals. It's not a quota system, but set goals so that, maybe we need to reach out into that community and let them know they're welcome, that we're going to pay attention to reasonable accommodations for people with disabilities in the job market, in federal contractors and so on. That's been attacked all year. They're backing down on that now. And we've been working for years to try to do away with the sub-minimum wage. Now they're rolling back on that too. So again, I just made a note here on the shutdown. 1 in 5 federal workers has a disability. 1 in 5 now. So a lot of the people that were laid off, hurt by the shutdown, are people with disabilities who, as you know, have a lot of other problems to contend with other than just a paycheck. So these things, the diminished access to employment means fewer skilled and qualified workers, a decline in work and buying power, marketplace participation. Well, you didn't come here to listen to me speak, but I just wanted to let you know that I hope this institute will continue to move ahead under the direction of both Craig Owens, our director, and Daniel Van Sant, who is our disability director. Do you all know Daniel Van Sant? Daniel? So I hope you'll think about this as a place you're always welcome, not just to come for a panel, but to come and do work here, to give us input, to help support our efforts in making sure that we live up to our goals and our promise of full participation, full inclusion, if I can use that word, in all aspects of what we do here. So with that, I'm going to turn it over to Dave Price. Dave, as many of you know who live in central Iowa, was with WHO TV for years and years and years. Oh. Can't believe how young he still looks. I was just a teenager when he went to work there. But I always considered his coverage of me when I was in the Senate to be fair most of the time.
They're compliments.
Just doing his job, holding my feet to the fire.
He will do that.
A good journalist. But now he is, he just told me he's with, I said, where are you now? I don't see you anymore. Well, that's because the TV stations he's with are all around Iowa, but not in Des Moines. So if you want to see Dave Price, well, I guess you got to move to Ottumwa.
They have the internet.
Huh?
You can watch online.
Oh, you can watch online? Hey,
I'll show you how after.
I'm used to a remote. You turn the TV on and. But Dave, thank you very much for being here and for being our moderator, and you're going to introduce our panel. Thank you all for being here. Thank you.
Never had the senator introduce me before. Uncomfortable. Felt like a roast. Thank you. And thank you for all of you coming in on a Thursday night. All right, so let's go left to right for our panel tonight. Alex Waters on the far left there. He's been serving 3 terms, right? 2 terms, sorry. 2 terms on the Sioux City Council. Hello.
Hello.
Liz Matney, I knew from her previous job when she was running Medicaid in the state of Iowa. Now she's out on her own Andeli, is that how you pronounce it?
No.
Oh, what's correct? Andeli. Clearly, I'm not sophisticated. I grew up in Southern Illinois, so we're not classy enough for that. Hello. And Ben Schuberg, the CEO of the Iowa Association of Community Providers. Hello to you as well.
You.
All right, so there's our trio for tonight. I forgot to say hello to those of you watching online as well. All right, so let's start with the big one. The senator talked about this a little bit. We'll go into it a little bit more in depth. So let's talk about HR 1, also known as the Big Beautiful Bill or the One Big Beautiful Bill Act. I believe its full title. So that passed this summer. That was a Trump administration priority. Republicans helped get him through, so it's signed into law this summer. Does all kinds of things, taxes, immigration, a bunch of stuff. But we want to focus in particular when we're talking about issues that are near and dear to the folks in this room, the disability community. So we want to look at these, what could be a potential about $1 billion in cuts to Medicaid. And as we know, in our state, we have about 700,000 people who rely on Medicaid services for health insurance, including more than 100,000 seniors and people with disabilities. So let's maybe talk about it. I know some of these are still going to kind of unfold here, but what do we know about the cuts and how that will impact folks?
Well, Dave, I really appreciate the opportunity to be here with all of you. And it feels a little odd not only to have the senator probably introduce you, but also to have Liz Matney being my Vanna White of holding my That feels a little uncomfortable. I appreciate your service. You, how about, yeah, very much so. No, but I think it's a really poignant question and one that needs to be asked. I've thought about how this bill and the repercussions are going to be felt throughout Iowa. And as a person with a disability and as someone that's had to navigate the system, I unfortunately have to think a lot about that. And I've thought a lot about not only the situation in Iowa currently, but what could happen because of this bill and because of the things that will be happening or being implemented. And just to paint you a little bit of a picture, I mean, I actually had an accident when I was 18 years old. I was 2 weeks into my freshman year at college and I had an accident. I had to spend 6 months in rehabilitation before I ultimately was inspired by my caregivers and the people around me at the hospital to achieve more. And I went back to school. I got my degree. I got a master's degree. Even went out to spend some time with Senator Harkin in Washington and his team out there, where I worked with the U.S. Department of Education and worked on a few projects over there for the summer before ultimately coming back, getting involved in politics, as Dave mentioned. Ran for public office myself and served 8 years on the city council in addition to my full-time job at Morningside University. All of that being said, I've had to rely on Medicaid and these support services for quite some time. Most of my life, I've had to rely on these services. And it wasn't until after the pandemic that it really struck me just how broken the system is and how much the system is failing so many Iowans. And that was when I was called to advocate and really get much more involved in the process and quickly get the phone number for this one next to me when she was the director of Medicaid. Well, what I require was I just needed the opportunity. I needed the supports necessary to be able to get in and out of bed in the morning, to be able to go to work and to be able to serve the people of Sioux City the best way that I could. What I wanted. It should have been as simple as that, of people wanting to stay in their home, wanting to have the best care that they can, be out of an institution if that's what's going to be able to work, giving them the supports necessary to do so. So to answer your question, what I fear that will be happening because of this bill is just, first off, more uncertainty. Because if you watched the legislative session in Iowa the last year, they actually passed work requirements, and now they're being implemented or as a part of this on the federal level as well, which will require 80 hours of work, community service, or education throughout the month for people with disabilities. Now, as was argued in the state of Iowa, I understand. I understand if you can and want to work, I hope that you can. But we also want to make sure that those individuals have the support to do so. And if you're not doing both, if you're only doing one without the other, it's a disservice, not only to your state, but also to those individuals. You're not empowering them to reach their full potential. And then I think of that a step further. I think of the paperwork that's going to be necessary for this. Now, I can't really get my mail out of my mailbox, let alone open it, let alone fill it out, because apparently in the state of Iowa, a lot of these programs can't think of how to fill out a form online, or I don't know, a PDF that's writable. And so I rely on others to get my mail, to not lose my mail, to help me fill it out and get it in a timely manner. And then take that into account where now all of our mail in Sioux City is being rerouted to Sioux Falls before ultimately going to its destination. Undoubtedly, things are going to get lost or delayed, or they're not going to be fully funded at the state level to have those staff members to process that. So then what happens? Because the moment that I don't meet that stipulation, my healthcare coverage is gone. That safety net is yanked out from under me. In addition to the work requirements, I think about the paperwork that's now going to need to be filed every 6 months. My mom, who is a rock star of a mom, we all should be as lucky as I am to have that amazing of a mom. Can we give my mom a round of applause? I always try to embarrass her as many times as possible, but it's only because she's amazing and has been my rock through so much. As many people with disabilities have experienced as well, undoubtedly. What I will say though is we just filled out the paperwork that's necessary to retain my Medicaid benefits, the MEPD, the Medicaid for Employed People, which essentially covers my ability to get out of bed in the morning and go to bed at night and other cares that I need. Now I'm going to need to fill that paperwork out every 6 months. And let me tell you, the fear, the stress, the mental anguish that I have in filling out that paperwork, knowing that if I fill out something wrong, if I make $5 over the income threshold, if I leave something blank that I shouldn't have, that all of a sudden I'm going to be losing all of that benefit is terrifying. And the notion that now I have to do this twice a year seems fairly unbearable. And I worry about it for similar reasons of the work requirement of, will it be processed? How will it be analyzed? Who is analyzing it? Do they have adequate time? All of those things while I lie in the balance. I wait in the balance. On bated breath, just nervous as to whether or not I'm going to be able to continue to get out of bed, go to bed at night, and do my job. Serve the people of my community. That's the American dream. That's what Senator Harkin fought for. And it's already difficult enough in the state of Iowa. And I just really worry that those are some of the ways that this bill and these cuts could have a profound impact on people with disabilities in Iowa. And I know there are probably more, but I want to let the other panelists have them all.
Very good.
Yeah, it's really hard to follow Alex really in any situation, but especially with that testimony right there. I mean, Alex's experience, he's the expert of lived experience and how to represent that in terms of like bigger policy issues. So I had a response written out for this and just like throw it all away. Okay. So even though there wasn't an explicit cut to Medicaid or a cut to disability services, HR 1's going to impact everybody in this country. You know, it doesn't matter whether you are disabled or not, whether you are on Medicaid or not, this bill will impact everybody. We're sucking $1 trillion out of the healthcare system over 10 years. That's a lot of money. There's still going to be a lot of money in the system, but $1 trillion is a lot to take out without understanding all of the ramifications. Obviously, A lot of that is going, for very complicated reasons, is going to hit the hospitals because of one, payment financing methodology that essentially is now going to be prohibited after 2028. Which is not a bad thing. You know, the federal government is tightening up some of their regulations so that they're not having to pay more than what would be the fair share, right? So I get that. But we are looking at, like I said, $1 trillion getting sucked out. We have $50 billion in rural health transformation funds that states have already applied to the federal government. They were due November 5th. And then the federal government will look at those applications and make determinations by the end of this year how much each state will get. That's not, 50 billion, 1 trillion, that doesn't match up. And so it's been pretty clear that that $50 billion is not meant to be a backfill. They are really wanting, and it's necessary, to really think about reshaping the entire system. When we established healthcare in the United States, and when we established Medicaid, I don't think anybody who wrote Medicaid policy envisioned healthcare becoming what it is today. And so we kind of have to reimagine what we want Medicaid to be within the healthcare system. Home and community-based services, non-institutional services for individuals with disabilities. That's still an optional service for Medicaid. That's not required. And so that is one component of things that we just really need to kind of take the whole program and figure out in 2025, what should the program look like today based on the individual's needs that we have in the country. People are living longer, thank goodness, because medicine has advanced, technology has advanced, but that has really kind of blown up the formula for how we provide healthcare. And so we need to just rethink it top to bottom. Rural hospitals obviously are feeling a lot of pressure, and that's why, of course, the Rural Health Transformation Fund was included in HR 1. But it's more than that. We really need to reimagine even hospital services in our rural areas. We have here in Iowa 118 hospitals, I think last I count. It might be give or take a couple. That's a pretty big number of hospitals for the size that Iowa is. I'm not saying that not every community needs emergency services, because they absolutely do. Every community needs emergency services and preventative services and transportation. They also need to have access to behavioral health and disability services and those things. But does every community need a top-line cardiologist? Maybe not. And that's what we're kind of paying for in the system right now, because we have arranged it in a way that we have access kind of just always within, arm's length for everything. And we need to have a little bit of flexibility, I think, in our consumerism to say that I don't need everything around the corner. There are some things I can travel a little bit of a distance for, as long as we have transportation set up for people that need it, right? But again, this bill will impact everybody. It'll impact healthcare. It's going to dramatically change the face of healthcare, but it's also going to impact our economy, top to bottom. In our rural communities, hospitals oftentimes are the major employer. If we start seeing hospitals shut down in those rural communities, we're going to start seeing towns die, because they're not going to have the employment opportunities. They're not going to be able to attract new people because they're not going to have that healthcare infrastructure. And so with the Rural Health Transformation Fund project, Iowa's is online. I would recommend going and checking it out and engaging yourselves, being engaged in the process to redesign Iowa's healthcare for the future.
Definitely difficult. Okay, everybody hear me okay? Definitely difficult to follow these two next to me, but I'll add a little bit to it. But first, thank you to the Harkins for allowing this event to happen too. What a great night. It's great to see everybody here. I want to maybe share a little bit different perspective than maybe what Alex and Liz had shared. So our association, we represent about 132 organizations in the state of Iowa that provide disability services, mental health services across the entire state, every county, many rural communities, and we cover a wide swath. And Liz had mentioned rural hospitals quite a bit, and I would say right behind a lot of those hospitals are community provider organizations that also deliver the disability services on the ground. And so when I look at this bill, I think about what are the impact to these organizations that rely almost solely on Medicaid funding to operate. So a lot of these organizations, their revenue is typically 90 to 95% from Medicaid. So a change in funding, a shift from the federal level to the state level, if there's any changes in funding, directly impacts these organizations. And to connect the dots a little bit further, these organizations carry out the services that Alex talked about. They are the caregivers, the folks on the ground in the community delivering these services. So as we look at HR1 and the passage of that, and what does that look like, I think for our provider organizations, in the short term, we're looking at, okay, in the next year, 18 months, how is that going to impact our organizations? How will that impact individuals? From what I know, and there are a lot of fact checkers in the room here, so I've got to be a little bit careful. But immediately, I think as we're to look to this coming year, I think the state will be looking at the Iowa health and wellness population. There's about 180,000 individuals that are part of that population that receive Medicaid. That would fall into kind of the work requirements that Alex was talking about. And so within that population, as those work requirements are implemented in January of 27, as he said, there's going to be more administration of that. There's going to be, more frequent eligibility checks on that. And certainly, as Alex shared, that's a burden for the individual, but it's also a burden for the state as well. It's a burden for the department to do that as well. So as we look at just that bill, it's going to be more difficult, I think, to administer some of those ramifications from that bill. So I really think that over time, and if we look, I wish I could give a good picture into the future, but it's gonna become more difficult as we start looking down the road, year 1, year 2, year 3. I wish I could really give a good picture of like year 5, but as the shift in funding responsibility really shifts to the states, every year that passes by is going to probably become more difficult, and harder decisions are going to have to be made by the state of Iowa and by other states because of the decrease in funding from the federal level. So
I wonder if we can pick up on something that a couple of you have mentioned, but as we will see, whatever the sizable number will be of folks who will lose Medicaid insurance coverage, will there be kind of a ripple in that the financial strain of that will go beyond those immediate families out into our communities? And I guess what I'm thinking is, is the increased cost burden on the healthcare providers, maybe just our premiums altogether. We're also looking at the end of the year as it stands now, the enhanced credits for the ACA, Obamacare. If those go away, we're already seeing forecasts of, as those of us who have insurance, we're starting to go through our open enrollment period, and they're all getting more expensive. So how do you see that kind of the ripple effect of this playing out in our communities?
I'm gonna go first again. Okay. How did I get so lucky?
Who's that next to me?
Yeah, exactly. Liz is just like Alex. So I guess, Dave, the way that I think about this, one of the unforeseen consequences, or I think one of the ripples that will occur or could occur, I think it's easy to surmise this, is that, look, I need caregivers every single day in order to, as I said, get up, get out of bed, get my cares, and be able to go to work. If I were to lose that safety net of Medicaid, say for instance, I didn't meet the requirement, I went over the income threshold, something happened, it was lost, whatever happened, I lost my coverage for Medicaid. Private insurance refuses to pick up that what they call custodial care. I think that's another fight for another day. I don't think that's right either. But for now, Medicaid has to pick that up as a state program. So they're the only ones. And that's why I have to jump through all of the hoops of whether that's my income threshold or all of these other things in order to stay eligible. Should I lose that? A good friend of mine actually said, look, I can't stay below the income threshold in Iowa. I'm going to do private pay. And so what's going to happen is she's an accountant. She's a quadriplegic, much like me. However, she was smarter and got a major that, would pay the bills a little bit better. And so, but she's an accountant, and this last year she calculated she spent $34,000 on care.
Yeah.
The troublesome part of that is, unless you're come from means or your family has the ability to pay for that private care, or you have a career that allows you to do so, oftentimes I think what Iowans are finding, and what I fear if I were to lose my coverage of Medicaid or through these services, or other Iowans would, who does that care fall back on? Your family members, your friends, loved ones, anyone you can ask, or anyone that's willing to support you. Now, the reason that I say this is a ripple effect is it doesn't just affect me. If I were to lose that support service, suddenly I have to look around at who's going to provide my care. And you all remember I have a rock star in the room. So suddenly my mom, which has happened, it happened over the pandemic, has to provide my care. Well, now I might be not in the workforce because I can't regularly have that support. Or if I am, my mom had to step away, or a family member had to step away from their full-time job. And then it just continues from there. And the ripple effect is Iowa is already facing a workforce shortage. Companies are hurting. If they're not laying people off because of tariffs or other measures, we're looking at shortages. And I'm afraid if I lose my supports, not only am I giving up my position, but I'm also maybe taking a family member's ability to stay in the workforce away as well. And so it just has these impacts, whether a hospital closes and then all of those people are without jobs, or family providers and friends are having to step in. That's the ripple I fear.
For a big chunk of the population, it's always the goal to eventually move people off of Medicaid. That other than individuals who are permanently disabled, it's a safety net program for people when they're in tough times. So we want to see people get off of Medicaid at some point. That should be good. However, Alex has outlined a lot of the impacts, like what happens to the individual when they lose the coverage that they need. This isn't just, it isn't just the safety net. It's for Alex, this is life and death, right? So I think it has a lot of impacts, and Alex did a really good job of talking about the individual impacts. I think from a system perspective, you see the ripples, like I said earlier. I mean, it's going to impact everyone. The ripples are going to turn into waves that hit every economy at some point. I think about Ben's providers who have their direct care worker staff. Some of those direct care worker staff rely on Medicaid, the health and wellness program, Medicaid expansion. And so they'll be having to meet those requirements, which should be easy. They should be able to get that paperwork in and maintain their coverage. Now, if something lapses, now you have a much bigger problem where somebody loses their coverage. Maybe they have to leave work and then that impacts the employer. They have to find some other type of employment. And then Alex made some good points about deciding to pay private pay instead of using like insurance as a means to pay for healthcare. That also will impact the economy because otherwise Alex's friend would be probably spending that $30,000 on something else like a house, a car, a vacation, and now they don't have that money anymore. And so in those ways, like it's all connected. It's going to have pretty large ripple effects on our economy, I suspect.
Just a few comments and also just a different perspective as well. Our community providers deliver care very efficiently in the community. Typically, whether it's an HCBS provider like someone providing supported community living, or even as we talk about like a community mental health center as well. That type of care is delivered very efficiently and cost effective right now. And I think if we get into a situation where individuals aren't able to access those community-based services or outpatient settings, for example, and individuals then start accessing, emergency rooms, for example, or inpatient settings, the cost of that care just increases substantially. So right now, the support that we have through Medicaid delivers very cost-effective care in the community. Our goal for our community providers is always to provide that in the most integrated setting in a community. And so if we look at situations where Medicaid could be jeopardized, to me, that could only increase costs in other areas. If care can't be delivered in the current settings, for example, if people aren't able to receive that in the home of their choice, but instead somewhere else in some type of facility, that's going to increase costs quite a bit. Additionally, Liz mentioned direct care professionals, DSPs, and just the fact that some of them do access Medicaid services as well. They rely on that too. That workforce is so important in Iowa in order to deliver the care to individuals across the state, that jeopardizing funding to organizations that employ those individuals can have some pretty dramatic effects. I wanted to share too a figure that just our organizations that we support across Iowa, just our payroll is about $500 million for us. Now, of that amount, about 90 to 95% of that is Medicaid. So I want you also to think about Medicaid not only as obviously a vehicle for super important services that are carried out, but also it is an engine that fuels a lot of jobs across rural Iowa. And that's something to think about as well as Medicaid is impacted at the state level. So we just had a renewal survey that just went out, so we have some pretty fresh data. There's over 100,000 individuals in Iowa that work in this industry, and they all rely on Medicaid that comes down from the federal level through the state to these provider organizations for employment as well. So it's at the center of everything, of course, is the individuals that receive services, but it's also much broader than that too. Medicaid is very broad and woven into the fabric of care delivery in Iowa.
And Dave, if you don't mind, I just wanted to touch on something that Ben brought up that I really appreciated. And just wanted to at least provide a little more context, because sometimes I forget to do this. I think we need to remind ourselves, and I remind elected officials anytime I have a meeting with the governor or leadership in Iowa or the legislature. I tell them that I'm coming to you as a person with a disability that relies on these services. But I'm also advocating, or I'm raising the red flag to you. I'm trying to turn on the warning lights that Iowans are aging. And if there's one thing that I know about these aging Iowans, is they want to remain in their home. They want to live on their farm. They want to have supports in their community. They don't want to lose those community supports, those caregivers that Ben is talking about. And that's who's going to provide the care. And so suddenly, not only do people with disabilities need this, but all of those aging Iowans have that need all of a sudden. Or heaven forbid, I remember having a conversation with some elected officials and saying, I would never wish an accident upon you. I'm not saying that, but if you would get hit by a car or have an accident on the way home tonight, you suddenly could use the exact same care or need the exact same care that I need today. I didn't anticipate this to happen. And if you don't have the infrastructure in place, if you don't have the funding for these individuals that are providing that essential care to allow you to be in your home or to do your day-to-day life, where's that going to come from? What is that going to be? And I think it's important to think that it's not just because I use a wheelchair that it's people with disabilities, but as Ben alluded and Liz talked about, it's going to be wide impacting. Sorry, Dave.
Oh, not at all. I mentioned some folks are watching online, and I suspect some of them may be in some of our rural communities across the state. Maybe some of you are as well. And Liz mentioned a little bit about rural. Actually, I think each one of you have in one way or the other. But can you maybe zero in on how these changes could, in particular, affect some of our smaller communities? Well, why don't you throw us
You
for
want
a
me to go
loop and you
first?
start here.
Hey, there we go. Hey.
Give Alex a break.
Yeah, thank you.
Just from my experience, they're living in rural Iowa, which I grew up in a rural small town. Sometimes it's harder to access services. It's harder to access the same types of things that might be available here in Des Moines or in larger areas. So accessing services in rural Iowa could be more difficult, and I think will be more difficult, especially if the funding changes and there's just less of it out there. I also think a big part of this too is that workforce can look a lot different in rural Iowa. You know, if this funding is affected, as I've shared, you know, our provider organizations rely almost solely on Medicaid funding. If that's impacted at all, that impacts their workforce. And I think it's exacerbated in rural small towns as well. As typically we've seen that, you know, in a rural town, they don't have the same labor pools to pull from that other larger areas can. And even though in rural towns, there are many individuals, there are also provider organizations that employ a lot of people, a lot of individuals that need care, and that need still exists, whether it's urban or rural. But I do think it's going to be more difficult in a rural area.
Yeah, without a doubt. The rural areas are going to get hit hard. In Iowa, we have definitely different concentrations of like Medicaid enrollment county by county, but I would say in every space of rural Iowa, there are individuals on Medicaid and there are individuals with disabilities. There are much fewer resources, there are fewer people, those people become caregivers. You know, to Ben's earlier point, the workforce just isn't there. The margins are really, really thin. Sometimes technology adoption isn't great. And so we might have some folks in rural areas who are scared of computers or technology and maybe still working with pretty rudimentary documentation platforms. There's also just a lot of time that has to be spent on the road, like for, if you think about like providers just driving from one client to another, and all of that costs money. Also just the rural communities are aging in a different way than our urban populations are. The aging density is much greater in those rural pockets. And folks are getting more isolated in rural America in general, but Iowa specifically, because people are moving away from rural areas, and the folks that are left behind don't always have the same social interaction that they used to maybe 10 years ago. And so there's a lot of just fragility to the infrastructure. Budgets are hard, county budgets are hard, city budgets are hard. So I think, they certainly will be impacted in a very different way than maybe the urban centers will.
Share something? Could I share something real quick? Liz reminded me of something that just popped into my head too, specific to rural areas. As we talk about like employment services, for example, employment supports. So individuals, with a disability that want to work, that are willing to work, but may not, because of the rural area, have a provider readily available to support them in their working endeavors. That is already difficult right now, but I think it could be even more difficult into the future with some of this too. It's employment services is one of those difficult things in rural Iowa.
Like rehab or.
Yeah, absolutely. As individuals, Alex asked, like voc rehab, they play a part in that too. But like job coaching, for example, for folks that are familiar with that, typically that would require a provider to be on site, help individuals. And a lot of times in small town, it's hard to find organizations or providers to be able to drive back and forth in rural Iowa to provide those services efficiently. But I could see that being even more of a problem in the future.
And it's an interesting conundrum too, because I think that there have been moments in time where the assumption was if you throw more money at the problem, the problem goes away. And I think Ben could probably attest to some of his own providers' experiences that kind of no matter what amount of money you are offering from an hourly wage perspective, workforce is still really, really challenging. I think back to the discussions around Glenwood and, whether or not the state was going to close Glenwood. One of the factors that were considered was that there couldn't find anybody to work at Glenwood is one of the problems. Not enough people were willing to do that. And so that is also just an ongoing challenge.
Dave, I'll be brief because I think these two did a great job touching on the rural aspect of this, but I would just share I talked about the workforce shortages that Iowa is experiencing and the challenge that I think we are facing as a community. I think another part of that is going to be the brain drain, if you will, or the younger people that are going to have to move or find other opportunities. And I know that myself, as well as others with disabilities that perhaps are in my age range or even just of working age, that are going to have to move. They're going to have to leave, whether it's those rural communities or even some larger areas. Sioux City is the fourth largest city in Iowa, and we have 2 agencies that accept Medicaid that support that. And neither of them are accepting any new clients, and neither of them have adequate supports or adequate staff to probably support the people they do have. I will tell you, my agency has not fully staffed me to the levels I need since the pandemic. I've had to support that by recruiting, training, and everything of my own care. And in rural communities, it's even less. And so suddenly I'm left in the predicament, and I've talked with the legislature about this. I want to stay in Iowa. This state means something to me. I remember believing in it when that man was in office. I remember believing in it when we stood for values and we put people over politics. And I don't want to leave, but unfortunately, people have to make that decision and go where be able to get the supports necessary. So I've had to look at states that have better systems in place.
I keep having thoughts that pop into my head, Alex.
They have them all.
So bear with me. I did want to share that over the past few years, I think it's important to note the Iowa legislature has been very supportive of services, has tried to invest in services. In fact, last year in session, there was a targeted investment made specifically in employment services, which we're very appreciative of. So if you think about the investments that they continue to make, and even during the pandemic that we were lucky enough to receive quite a bit of ARPA funding from the department as well. There were investments made over the past few years into services to try to retain, sustain services, keep the workforce intact. And that was extremely helpful over the past few years. And I'm very appreciative of that. What I will say is that our work never ends. Our work is never done. The work will continue year after year. People will always need services and supports. That's why they're called long-term services and supports in our world. It doesn't end. And so with that, I do worry if at the end of the day, over the next 10 years, we look at a situation where there's less funding in the system, it's going to be up to Iowans, it's going to be up to the state of Iowa to determine how they're going to impact individuals with disabilities in Iowa. And that's hard stuff. That's hard stuff. And there's going to be really tough decisions, I'm sure, that are going to be made. But I do say, just from experience over the last couple of years, we have felt supported. I know the department, when I say the department, I talk about Department of Health and Human Services, we typically interact with quite a bit. They've been very collaborative in trying to work with providers, work with individuals to try to provide the best care possible. When Liz was in her position, was very fortunate to work closely with her and feel very supportive on a lot of different initiatives. But as we move into the next 2 years, 3 years, 4 years, it's going to get harder and harder. So I just wanted to share that we have been fortunate, and I hope we continue to be.
I know we're already at the top of the hour, but I want to talk about education here. Another priority of the Trump administration has been to essentially get rid of the Department of Education. Specifically, how do you see changes when it comes to special education services in light of this? And we'll see if maybe some of this starts pushing some funding down to the states, which is how it's been described somewhat. But how do you see these changes, or what changes do you anticipate with this?
I'll go first.
Thank you.
So I don't have a really robust answer, but as the former Medicaid director and as someone who has been, I worked in the Medicaid program for almost a couple of decades. And so I'm always thinking about, all right, how is this policy change going to impact Medicaid? And so I've watched over the last, decades, certainly, but probably a couple of decades, shifts costs just continue to shift towards Medicaid. And so some of the kind of Medicaid's budget expanding and expanding and expanding, I mean, some of that is real and some of it is manufactured by budget shifts. And so I I am a little bit protective in thinking about how those school-based services or costs might shift over to the Medicaid side of the budget, and then Medicaid's going to continue to get scrutinized and ask for cuts. Similar to what has kind of played out with like some of the commercial insurers and Medicare, and so that's one concern that I have.
I'll just speak anecdotally, and I want to preface this by saying while I work at a university, you know, I can't speak directly to some of those impacts or what's going to be felt, or just speculate of what that would be. But I will tell you, in my experience of what I've seen from friends with kids with disabilities, et cetera, is what I worry about what's coming out of the administration and what could happen at the state level is we continue to erode protections. And we continue to erode funding to provide the support services, systems, staffing that's necessary to give these people with disabilities, varying disabilities, an opportunity to learn alongside their peers, or to be able to have that interaction, or to be able to reach and fulfill their life or their full potential of what they could reach for, because they're not given the supports that are essential to their development and to that growth. And so I worry that if we continue to shift funding as a state to a more voucher-based services, which seems to be concentrating a lot of money in more of the private school system, or you know, those that have the ability to go to those schools, if they don't have those same protections for individuals with disabilities, or they're not providing that same level of service, I worry that we won't have the protection to provide that, and public schools will not be able to fund or be able to afford those same things. And unfortunately, I worry that students with disabilities will not be protected or given opportunities that they otherwise could or should.
I feel like I'm speaking way out of turn here, but I'm gonna try to channel my wife, Emily, who's a special education teacher. When I think about education a little bit, I have to go back to when I was working as a community provider, specifically when you're talking about transition planning and individuals that are planning, leaving school and transitioning into early adulthood. That transition, it's important that many people are involved in that, and there are many people involved, whether it's the school, providers, voc rehab, a lot of different folks involved with that transition. I think about folks that are wanting to access those different menu of services after they leave their education. What does that look like when they leave school into services? Does access change? Are there still available waiver slots as they transition? I think about that kind of stuff as kids, graduate and move on. I think that's important to think about how that could be impacted as well in transition planning.
I know we went over a little bit, but Alex, Liz, and Ben, thank you very much for sharing your thoughts.
Can we leave with like a moment of optimism? I don't want everyone to walk out tonight just feeling like kind of
Doom and gloom. Yeah.
doom and gloom. Yeah. Here's the thing about Iowa. We love progress, we hate change. And so just kind of, keep connected to that inner core of who Iowans are. Home and community-based services started here. The ADA was born out of Iowa. It's like, we can do it. And if nothing else, thank you to HR1 for giving us a reason to get together, to talk, and to be innovative and to think about new solutions.
I mean, I would give a rah-rah speech as well, but I don't know if I can second someone that found a way to commend HR1 for passage. So I would have gladly gotten together with all of you to have a different discussion, rather than that. But, you know, one of the questions that we had, that we weren't able to get to talked about, or maybe I just didn't address it in that way, was how the state of Iowa could rise to the occasion. And I literally have in my notes that I fear that they won't rise to the occasion, that our legislature won't. But then I was sitting here and it was something Ben said about the legislature and how he felt supported. And I was thinking, okay, well, you know, with me, the mayor always says hope springs eternal. So I need to maybe think about this optimistically. And I think we do have a tremendous opportunity. People with disabilities and people with the proper supports are achieving more than they ever have. They are engaging more than they ever have. The pandemic, no matter how horrible it was and how many people and loved ones we lost, it opened the doors for a lot of people because companies were forced to think differently about how we worked, about how we engaged, about what was essential and necessary. And as long as we talk to our elected officials about what those supports mean and why they're essential and how we all make up the fabric of Iowa and how we contribute to this big, beautiful project that is the United States, I really believe that that change will happen. I really believe that we can come together and find ways to empower one another, whether that's through bills like Work Without Worry or just conversations about supports that are necessary in order to all achieve our goals, which is increasing our workforce, or which is just having a better quality of life and living and dying with dignity. I believe that we have it in us. So I guess, yes, great work, all of you.
Thanks for backing me up.
I got you.
Okay, this is Daniel from the Harkin Institute speaking. How about one more round of applause for our panelists? Thank you so much for sharing your insights with everybody this evening. And I also want to thank all of you on behalf of the Iowa Disability Policy Alliance. We have a full room here tonight, a lot of people watching online. Iowans are turning out. We're interested in these conversations and we are not going to be quiet about it. So thank all of you for taking a stance tonight to show up and engage with all of this. And the conversation is not going to end just because the panel is ending. I hope all of you will stick around and join us in our atrium where all of the other Alliance members have tables with resources and information. Please don't go anywhere. We'll just see you in the other room. But thank you all for being with us this evening. Yeah.
Well,
Thank you all very much. Good to see you. Good to see you as well. Yeah.
Thank you so much for the moderation and the research of the panelists.
Thank you. Any chance I could get a picture with you guys? Like, much. Thank you. Oh, excellent. Thank you. So right now she teaches at kids at home. But she taught Cherokee for many years and then worked for the AA as well out of Lamar.